CGF, concentrated growth factors. An easy, fast and cheap way to obtain platelet concentrates.
The regenerative properties of the blood are related to the presence of platelets, leukocytes, stem cells and growth factors. The platelets contain numerous active substances that play an important role in tissue regeneration. These substances are localized in subcellular structures such as dense granules, alpha granules, lysosomes and microperoxisomes. Among these structures, the alpha granules contain most of the growth factors, such as TGF, VEGF, IGF, and others. The platelet concentrates represent a source of autologous growth factors for different clinical applications. Now we see in detail the CGF applications.
Medifuge setting, phase separator. Decontaminate the machine through the appropriate protocol. Then set up the program mode CGF. Put in the test tubes with blood within 2 minutes of the execution of first drawn blood. To draw blood, you need the following material: disposable gloves, tourniquet, disposable butterfly with tubes tray connection, sterile tubes without the addition of exogenous substances, disinfectant wipes. Place the tourniquet and proceed with the disinfection of the skin. Insert the needle into the vein and the tube into the tubes tray connection and wait until completely full. Remove the tourniquet and proceed with the disinfection. Place tubes in pairs on opposite sides of the rotor to allow balancing. Close the cover, set protocol CGF and press start. The separation takes about 14 minutes. During this time, prepare the sterile table with the necessary instruments and containers into which you'll put the CGF. After the separation process, in each tube will be 3 distinct phases: RBC, red blood cells; CGF, concentrated growth factors; PPP, platelet poor plasma. For each tube, do the following steps. Open carefully. Remove the PPP to be used later. Put the other 2 phases into a container provided with grid drain. Separate RBC from CGF. Put the CGF into the sterile container.
After seeing how to get CGF, let us see how to use it.
CGF can be used as it is or for preparations. An easier preparation is to use the whole CGF. CGF can also be mixed with bone particulate. For example, combios in 2 different ways. First way. Cut CGF into small pieces and mix with the bone particulate, reducing the fluidity of the preparation. Second way. Mix CGF with bone particulate using the previously decontaminated Roundup. Cut CGF into small pieces and put it into the metal container. Add bone particulate. Close the metal container, insert it into its holder, and then put it into the Roundup by starting the program. After a maximum of 16 seconds, we'll obtain an integrated mixture of the 2 components. CGF can also be modeled by using a specific pliers for membrane creation to obtain an autologous membrane rich in growth factors and easy to model. Or the injector for fibrin, which allows the use of the preparation in special positions without contamination.
The CGF can be used in different clinical and surgical fields. It can be used in oral maxillofacial surgery, orthopedic surgery, plastic surgery, and dermatology. There are several techniques for tissue regeneration. Platelet concentrates, and in particular CGF, represent a valid alternative for clinicians, but especially for the patient.